There are a lot of different theories and trends claiming to improve your health, but what really works?
And of course, we asked Dr. Rupy to explain 5 proven ways to boost your wellness.
We are talking lifestyle changes to improve your health. It's the latest subject of Ask Dr. Rupy. And Dr. Rupy, what are some of the things that are proven out there? There's always a lot of talk, which might be something that's not medicine that can help, but what are some of the proven techniques that we can talk about?
Sure. So today I really want to stress the importance of looking at methods to improve our health without relying on medications. This is one of the most common questions that I get asked from my patients is, how can I take care of my high blood pressure, diabetes, heart disease, whatever it might be, using diet or lifestyle changes versus taking medications? And so we're going to talk about some of the evidence behind some of these modalities. And as a doctor, I'm always looking at, what does the research show? What do the studies show? What are the outcomes? What is proven to actually help? So we're going to talk about 5 methods that are proven by evidence to actually show improvements. Now, as a physician, I'm also always trying to give my patients tools. So the first thing that I want to talk about, and we've talked about this before, is moving more. So moving means exercise. Now, exercise can be all sorts of things. It can be walking, it could be gardening, it could be just increasing the movement that you take. So taking the stairs instead of the elevator is an example. You want to be doing at least 30 minutes of movement for 5 days a week. That's at least 150 minutes. Or you could do kind of heavier exercises for about 75 minutes twice a week. So the more that you move, the better you're going to feel. Now, the next thing that we hear a lot about is diet. Now, a diet that's proven to actually help decrease blood pressure is something called the DASH diet. That's D-A-S-H. And this diet stands for helping to stop hypertension. Now, what it really entails is decreasing the sodium or the salt in our diet and increasing calcium, magnesium, and potassium. Now, that sounds really complicated, but what it really is increasing fruits and vegetables, increasing whole grains, and decreasing the sugars, the sweets, and some of the red meats in our diet. Reading the labels on packages. This is something I didn't even know how to do. Nobody taught me how to do this, even in medical school. And so this is something that, I knew how many milligrams I needed, but how do I actually read the package? So taking the time to look at the package, how much sodium is in the package, and knowing what the limit for the day should be. And it averages between 1,500 to 2,300 milligrams of sodium in a day.
Getting rid of the processed foods and all that will be great. What about actually losing weight? How important is that?
That's a great question. And I think that's something that we're constantly drilling in. There are great health benefits that are proven to be associated with losing weight. But one thing I want to talk about a little bit more is actually waist circumference. There is data and research that shows evidence that reducing your waist circumference is related to an improvement in your overall health. Now, how this works is the more weight that you have around the waist correlates with how much fat there is around your internal organs inside of your body. And so when you have a lot of fat around the internal organs, those organs have to work harder, and that can be related to health conditions. Now, some of the other things that are proven to help improve health is cutting back alcohol and cutting back nicotine. Now, this is something that sounds fairly obvious, but we do know there are strong correlations with nicotine, cigarette smoking, and alcohol with not just heart disease, high blood pressure, diabetes, but even certain types of cancers. So really important to cut back and limit, especially even alcohol, looking at what the daily recommendations are and cutting back down to those levels, or cutting out especially nicotine and smoking entirely. Now, the last thing I want to talk about is stress. I think all of us can relate to stress being usually, unfortunately, a pretty typical part of our days. And so stress is strongly correlated with poor health. And so I think we can all feel it. When we're more stressed, we don't feel so good. So how can we improve it, and what does the data show? Interestingly, there's 2 main things that you can do to help decrease even your blood pressure when you're stressed out. That is listening to peaceful, calming music and cutting back your work. So a 40-hour work week for most people seems to be okay. Going over that can increase stress significantly, which can impact your health. But having a high-pressure job or being in a high-pressure situation or working in a stressful environment, even less than 40 hours a week can impact your health.
What would you say, Dr. Rupi, is the first step that people should take if they're thinking of trying to use any of these methods to get healthier?
So the first step is always to ask your primary care physician. Make sure to check with them that whatever you plan to do is okay for your health condition, but also to keep track of how things are going. The key is really that this is in your hands and that you can impact change and improve your own health. And you can do it in hand with your doctor.
Sounds good. And as always, if they want more advice, they should follow you and look for your segments here on Living 808. Thank you so much, Dr. Rupi.
Thank you, Tanya. Take care.
Okay, there you go. 5 things from the doctor that will help you if you're on the path towards improving your health.
Was she saying not to work more than 40 hours a week? just wondering.
And not to stress and to do lots of things. And we can all take what we can from that and try to implement little changes.
Can't wait to hear her next report about naps.